and blood vessels, RAD 310, Sectional Anatomy, Bachelor of Science in Medical Imaging program, Chris Gibbons, instructor. The heart and blood vessels of the thorax are presented in this media module. Sectional imaging is used extensively to demonstrate heart abnormalities and vessel disease. In this image illustrates the use of CT imaging to detect trauma of the aorta. This particular patient was injured in a high-speed motor vehicle accident. In the axial image, note the dark grayed line that divides the lumen of the aorta. This is an indication of an aortic dissection. The reconstructed CT demonstrates the dissection of the aorta in the sagittal plane. Upon completion of this media module, you should be able to 1. Detail the structure and function of the pericardium. 2. Explain the composition of the heart wall. 3. Describe the vessels, chambers, and valves of the heart, including the blood flow through each. 4. Identify the great vessels, branches of the aortic arch, and coronary arteries. 5. Explain the main veins of the thorax. And 6. Identify the heart and blood vessels on sectional images. The heart and proximal portion of the great vessels are protected by a double-walled sac, called the pericardium. The two walls are the fibrous pericardium, which is attached to the diaphragm, and the serous pericardium, which is made up of 2 layers. The space between the 2 layers contains serous fluid for lubrication of tissues during heart motion or the beating of the heart. The 2 layers of the serous pericardium have names. We have the parietal pericardium, which adheres to the fibrous pericardium. And then we have the visceral pericardium, may also be called the epicardium, and that adheres closely to the heart muscle and proximal portion of the great vessels. The wall of the heart consists of 3 layers. We have the endocardium, that's the thin inner endothelial layer. We have the myocardium, thick muscular middle layer. And then lastly, the epicardium. That's the thin outer layer in contact with the pericardium. Interesting to note, in sectional imaging such as echocardiography, it can be used to demonstrate the degree of wall motion of the heart. Radionuclide imaging can also demonstrate the amount of oxygen perfusion in the myocardium, which can be used as an indicator for coronary artery disease. The heart, as most of you know, has 4 chambers, 2 on the right and 2 on the left. The upper chambers are the atria, while the lower chambers are the ventricles. The right atrium receives the deoxygenated blood from the superior and inferior vena cava. It then pumps blood through the right atrioventricular valve or tricuspid valve into the right ventricle. The right ventricle receives blood from the right atria. It then pumps blood through the pulmonary semilunar valve into the pulmonary artery. The left atrium then receives oxygenated blood from the pulmonary veins. It then pumps blood through the left AV or mitral valve into the left ventricle. The left ventricle receives blood from the left atrium. Then it pumps that blood through the aorta semilunar valve into the aorta. Let's take a moment to discuss the valves of the heart. The heart valves function to seal the chambers and prevent the backflow of blood. There are 2 general types of valves. We have the atrioventricular valves, or AV valves, and the semilunar valves, or SL valves. The AV valves are connected to the heart wall by the papillary muscles and the chordae tendineae. They prevent the backflow of blood during heart contraction. They're located between the upper and lower chambers on each side of the heart. The right AV valve has 3 cusps and is also called the tricuspid valve. The left AV valve has 2 cusps and is called the mitral valve. The semilunar or SL valves prevent the backflow from arteries into the ventricles during relaxation. They're located between the chambers and the vessels. We have the pulmonary semilunar valve, again between the right ventricle and pulmonary artery. We have the aortic semilunar valve between the left ventricle and the aorta. Their name, semilunar, stems from the fact that they are crescent-shaped, looking like a moon. The great vessels are the large major vessels that include the aorta, the pulmonary arteries, the pulmonary veins, the superior vena cava, and the inferior vena cava. The aorta can be divided into three portions: the ascending, the arch, and the descending. The ascending begins at the left ventricle and ends at the arch. The arch itself, the top is at approximately the level of T3. And then we have the descending portion of the aorta, posterior to the pulmonary trunk and left to the bronchus. In the thoracic region, it's called the thoracic aorta. As it descends further in the body, it's called the abdominal aorta. The pulmonary arteries originate from the pulmonary trunk and are further divided into the right pulmonary artery and left pulmonary artery. The right pulmonary artery passes lateral and posteriorly to the ascending aorta and the superior vena cava. It's anterior to the esophagus, and it's also right to the primary bronchus. At the hilum, it then divides into two branches. The left pulmonary artery is shorter and smaller and more superior than the right, curves over the left main bronchus, and then enters the hilum above the left primary bronchus. The pulmonary veins, there are 4 in all. We have 2 superior and 2 inferior. We have the right superior pulmonary vein, which collects from the upper lobe of the right lung. We have the right inferior, which collects from the right lower lung lobe. We have the left superior, collects from the upper lobe of the left lung, and the left inferior, which collects from the inferior lobe of the left lung. The superior vena cava. This is formed by the junction of the brachiocephalic veins posterior to the right first costocartilage. Carries blood from the head, neck, and upper limbs and thorax. It lies posterior and lateral to the ascending aorta. And then lastly, we have the inferior vena cava. Formed in the pelvis by the junction of the common iliac veins. It ascends the abdomen to the right of the abdominal aorta. Because the aortic arch is so critical to sectional imaging, and so many major arteries branch off of the arch, let's take a moment to review the arch in a little bit more detail. As you recall, the aortic arch is the curved portion of the aorta between the ascending and descending portions. Again, several major arteries branch off of the arch, which are all easily recognizable on sectional images. The branches of the aortic arch are from left to right. We have the brachiocephalic, or innominate artery, the left common carotid artery, and the left subclavian artery. Notice how the brachiocephalic artery immediately gives rise to the right subclavian and right common carotid arteries at about the level of the right sternoclavicular joint. The coronary arteries are the first branches off the aorta at the base or the root. These arteries are very important in that they supply the heart muscle. There are 2 primary coronary arteries. We're also going to review the key points of each of those 2 primary arteries. We have the right coronary artery. Branches from the right aortic sinus at the root of the aorta. Gives rise to the right marginal artery and the right posterior descending or interventricular artery. Supplies the right atrium and ventricle, the interventricular septum, and the sinoatrial and atrioventricular nodes. We have the left coronary artery. Branches from the left aortic sinus at the root of the aorta. It gives rise to the left anterior descending artery, may also be called the anterior interventricular artery, and the circumflex artery. We also have the left marginal artery that branches from the circumflex. The left coronary artery supplies the left atrium, left ventricle, the interventricular septum, and the atrioventricular bundles. The coronary arteries come together at the apex of the heart when the anterior and the posterior descending arteries join. Let's turn our discussion to the veins of the heart. Venous blood is returned to the heart by the following vessels. We have the coronary sinus. This is the main vein of the heart. It runs along the posterior coronary groove, and it terminates into the right atrium. We have tributaries of the coronary sinus. We have the great cardiac vein, the small or right cardiac vein, the middle or posterior cardiac vein, the left posterior ventricular vein, and the oblique vein of the left atrium. Again, all of these are tributaries of the coronary sinus. And then lastly, we have the anterior cardiac veins. These are two small veins that drain directly into the right atrium. So in review, we have the coronary sinus, all the many tributaries of the coronary sinus, and the anterior cardiac veins, all of which drain the venous blood flow out of the heart. The azygous venous system provides collateral circulation between the superior vena cava. The azygous vein runs along the right side of the vertebral column, while its counterpart, the hemizygous vein, passes along the left side. Between T7 and T9, the hemizygous crosses midline posterior to the aorta to join the azygous vein. The azygous vein empties into the posterior superior vena cava at the hilum of the right lung. These two veins drain the posterior thoracic wall, the pericardium, the esophagus, and the bronchi. Before we begin our image review, I wanted to make note here of what the American Heart Association is doing. The American Heart Association published a statement to standardize the terminology used in cardiac tomography imaging. And they have two recommendations. The first one is all cardiac imaging modalities should define, orient, and display the heart using the long axis of the left ventricle and selected planes oriented at a 90-degree angles relative to the long axis. So they are defining what that long axis is of the left ventricle. Their second recommendation has to do with the names for the 90-degree oriented cardiac planes used in all imaging modalities. And they should be the terms vertical long axis, horizontal long axis, and short axis. Let's take a moment and look at some of those defined images using that terminology. We'll go through these images pretty quickly. Remember that you can always pause the video and take a moment to study some of the anatomy presented. In this particular image is the vertical long axis. Nice image of that, a CT image of the heart. Here is another vertical long axis image, but this time MRI. And again, notice some of the anatomy labeled here. It's a wonderful image of the right and left ventricles, the pulmonary trunk, the left atrium, and the bicuspid valve as well. Now switching from the vertical long axis to the horizontal long axis. Here's an MR image, again demonstrating the horizontal long axis. Also, there's a nice demonstration of all four chambers of the heart. And then lastly, we have an image, a CT image of the short axis. I think what's interesting in this particular image is you can actually see the papillary muscle. But please take a moment, pause at any one of these images, and study the anatomy presented. This is an axial MR image demonstrating the pulmonary arteries. First, find the large circular ascending aorta just posterior to the sternum. The pulmonary trunk is seen just to the patient's left of it. Look toward the posterior and note the bifurcation of the right and left pulmonary arteries. The main stem bronchi for both lungs are also seen just posterior to the pulmonary arteries. The descending aorta is the largest vessel in the posterior aspect, with the azygos vein demonstrated on the patient's right adjacent to the vertebral body. And the esophagus lies between the ascending aorta and the azygos vein. This is an axial MR image demonstrating the pulmonary veins. Note that this image was obtained slightly inferior to the previous image, so it's demonstrating the pulmonary veins that are inferior to the arteries. Beginning at the most anterior aspect, the mammillary arteries are labeled bilaterally. Immediately deep to those is the circular ascending aorta, with the superior vena cava just deep to it and slightly towards the patient's right. The right pulmonary vein is labeled below the superior vena cava. The right mainstem bronchus lies just posterior to it. Look straight across towards the patient's left and note the left mainstem bronchus. The descending aorta is posterior to that, with the esophagus immediately to the right, and the azygos vein in about the middle of the anterior vertebral body. The left superior pulmonary vein is the last vessel really to note in this image. It is anterior to the left mainstem bronchus. This is an axial MR image demonstrating all 4 chambers of the heart. Also note the location of the azygos vein just anterior to the vertebral body and to the patient's left of the much larger aorta. If you look closely, you can also see the mitral valve can be seen between the left atrium and the ventricle. The right coronary artery is also seen between the right atrium and the ventricle. Also, the circumflex artery is visible just anterior to the aorta. This is a coronal MR image demonstrating the ascending aorta. Just superior to it is the left brachiocephalic vein. Towards the patient's left, the main pulmonary artery is seen adjacent to the ascending aorta. The right atrium and ventricle are inferior to the patient's right ascending aorta. This is a coronal MR image demonstrating the left ventricle. What I want you to see here is the thickness of the wall as compared to the left atrium, just medial and superior to it. The right atrium can also be seen adjacent to the left atrium. Now above the heart, you have the main pulmonary artery, which is labeled, and just superior and towards the patient's right side of the pulmonary artery, the arch of the azygos vein is seen. You can also see the most superior artery is the left subclavian. Our last image is an MR image in the sagittal plane. At the top of the thoracic cavity, the left lung, the upper lobe, is seen curving over the aortic arch. Follow the arch until you see it change into the descending aorta. Just anterior to the descending aorta, there are several vessels. Please take a moment, pause the video, and study these vessels in a little bit more detail.